Hello friends, today we will be talking about anti-nuclear antibody. Anti-nuclear antibody. It is abbreviated as ANA. So what is this anti-nuclear antibody? As the name implies, this is antibody directed against nuclear antigens. So let me draw a nucleus for you. So let's suppose this is a cell and this is a nucleus inside a cell and this is the nucleolus. So you know inside nucleus there are DNA, histone proteins, RNA polymerase, enzymes, ribonucleoprotein. Variety of molecules are present inside the nucleus of a cell. So whenever the cell death occurs, like in any inflammatory state, in autoimmune disease, when the cell dies, the components inside the cell, the nuclear antigens are leaked inside the bloodstream. And when these nuclear antigens are exposed first time in the blood, what happens? That your immune system says that, oh, this is foreign, so I should attack it. So antibodies are produced against these nuclear antigens. So those antibodies that are directed against these nuclear antigens, these are called anti-nuclear antibody. So you may be thinking that these nuclear antigens leaks from inside the nucleus. So cytoplasmic components also leaks inside. So antibody must also be formed against the cytoplasmic components as well. Yes, if you are thinking it like that, you are right. Antibodies are also formed against the cytoplasmic components. Those are called anti-neutrophil cytoplasmic antibody. This is called cytoplasmic antibody, and this anti-neutrophil cytoplasmic antibody, this neutrophil, this is misnomer because the cytoplasm of the either neutrophils or monocytes, whatever cell may be, the antibodies are formed against the cytoplasmic components as well. But today's our topic of discussion is anti-nuclear antibody. So we will be not discussing cytoplasmic antibody. We will discussing nuclear antibody. Okay. Next lecture we will discuss those cytoplasmic antibody. Today we are talking anti-nuclear antibody. So what you know that these antibodies are directed against these nuclear antigens, the antigens contained inside the nucleus. So how do you detect it, these anti-nuclear antibodies? So you can detect it by either ELISA, where they estimate the titer of the antibody, or immunofluorescence, that is called indirect immunofluorescence. So either ELISA or immunofluorescence, it estimates the titer of antibody. Okay. So let's suppose your clinician says that you have a titer of 1:80 anti-nuclear antibody. So definitely you have got antibody positive, anti-nuclear antibody. So it means that you have a disease. I also tested my ANA and it came 1:160. So does it mean that I have any disease? No. Why? Because this anti-nuclear antibody has high sensitivity. High sensitivity means if you test in 100 population, 100 individuals, about 30 individuals have false positive ANA. Okay. So even it has false positive value. So we don't test ANA in every individual. Whenever we suspect patient may be having autoimmune disease with the clinical symptoms and signs, then only we test ANA. Otherwise we don't test ANA because there is a high chance of false positive. And as a person ages, these cells start dying and those nuclear antigens are more exposed. And so as the individual ages, there is increased chance of positive ANA. So this is also one important point that you should know. Okay, so you know that it can be false positive and it can be estimated using either ELISA or it can be estimated with immunofluorescence. Immunofluorescence. Okay. Now let's talk about different types of antinuclear antibody. So those are classified based on the staining pattern that we get in the immunofluorescence. Like let's suppose this is the nucleus and this is the cell. So I have deliberately drawn this nucleus bigger. This nucleus is disproportionately bigger when you compare to this cell, but I have drawn this just for your understanding. It is not like that. This much bigger nucleus can't be. Okay, and this is the nucleus, let's suppose. This is a schematic diagram. A schematic, okay? It is not real. So, this is the nucleus. This is the nuclear envelope. And here there are DNA, histones, RNA polymerase enzymes, ribonucleoproteins, and variety of other molecules. So, in immunofluorescence, if you see, you can see either diffusely fluorescence of this nucleus, diffusely. That we call homogeneous staining pattern. Homogeneous staining pattern. Or you can get like a speckling of the, like fine speckling or coarse speckling. Okay, so homogeneous, or you can get a speckled pattern, fine speckled or coarse speckled pattern, or you can get the immunofluorescence only in the nucleus. That is also called nucleolar pattern. Or if you get multiple dots inside the nucleus, it's called nucleolar dot pattern. Dot pattern. Okay. So these are different types of staining pattern that you get in immunofluorescence. So you can get homogeneous pattern, you can get a speckled pattern, that is fine speckled, coarse speckled pattern, or you can get other patterns like nucleolar pattern or antibodies around the nuclear envelope. So around envelope. Okay, so there are a variety of staining patterns that you can get. So depending upon that, you can guess what type of the antibody may be. Like let's suppose if you get homogeneous staining pattern, then what are the types of antibody that has homogeneous staining pattern, like anti-DS DNA, anti-single strand DNA, UNRNP. So if you get homogeneous pattern, you can think like these types of antibody may be there. Like in SLE, systemic lupus erythematosus, you know there is homogeneous pattern. So there is anti-DS DNA which is highly specific for systemic lupus erythematosus. In mixed connective tissue disease, UNRNP is positive. There also, if you do immunofluorescence, then you get homogeneous pattern. Okay. And if you get a nucleolar pattern, then most likely this is fibrillarin, anti-fibrillarin antibody. Okay. So in systemic sclerosis, you know there are two types of systemic sclerosis. One is called limited cutaneous systemic sclerosis, another is diffuse systemic cutaneous sclerosis. In diffuse you get SCL70, that is called topoisomerase antibody. And in limited systemic sclerosis, what you get? You get centromere antibody. And in Sjogren syndrome, what kind of antibody you get? You get Rho, La, that is called SSA, Sjogren syndrome A, Sjogren syndrome B. Okay, Rho, La. These are also nuclear speckled N. So if you get do immunofluorescence, you get nuclear speckling. If you get nuclear speckling, you can suspect that this can be Rho, La. Okay. So till now what did you understand? So let me summarize it. So what I told you, that antibody can be formed against the nuclear components, or it can be formed against the cytoplasmic components. So today our topic of discussion was antibody against nuclear antigens. It can be cytoplasmic components, but that will be covered in the next lecture. So antibody against these nuclear antigens are called antinuclear antibody. And you know that there can be false positive ANA, and there is a high chance of false positive ANA. If you get tested ANA positive, then it does not mean that you have disease or you have underlying pathology. It should be corroborated with clinical findings. And I have also seen some physician repeating ANA. So what I like to tell you, that there is no point in repeating ANA. Once you get titer like 1:160, and next time you get titer 1:400, it does not have any relevance. It changes. So what is the point of repeating the titer of ANA? It neither correlates with the severity of disease or remission of disease. If it is positive, it means positive. There is no point in repeating ANA. It does not correlate with the severity of disease or cure of the disease. So once positive ANA, it is positive. Positive means positive. Okay. And what are the different techniques of estimation of ANA? One is ELISA, where we estimate titer. Another is immunofluorescence. In immunofluorescence, we get a staining pattern. So what kind of staining is there? Homogeneous staining, or nuclear-speckled pattern, or nucleolar pattern, or nuclear envelope pattern. Depending upon that, we can guess what kind of nuclear antigens may be there. Antibody against those nuclear antigens may be there. Okay.